How to prevent swollen feet during pregnancy. It's no surprise that your body goes through many changes during pregnancy. You're probably prepared for the morning sickness, hormone changes, and weight gain. But swollen feet is also a normal part of later pregnancy. Although the majority pregnant women experience swelling around the feet and ankles, there are simple things you can do to prevent or minimize that swelling. Method 1: Reducing your risk for swollen feet. 1. Stretch your legs. Put your feet up as often as you can during the day and stretch your legs. You should flex your feet, rotate your feet, and wiggle your toes. These stretches and gentle walking can all pump blood back into your feet to prevent swelling. Try to avoid long periods of sitting or standing. If you do, take a 5-minute walk every hour to keep your blood flowing. If you have to sit for long periods of time, raise your legs for 10 to 15 minutes. Try to elevate your feet above your heart by sitting in a recliner, and avoid crossing your legs or ankles as you sit. 2. Sleep on your left side. Since pressure on your veins can cause swollen feet, ease pressure on the veins that return blood from your legs. To do this, try sleeping on your left side. Sleeping on the left side can also support kidney function. Don't worry if you wake up and you're on your back or right side. Just roll onto your left side and try to go back to sleep. 3. Avoid tight-fitting clothing. Don't wear tight clothing like socks or stockings with elastic at the top that can restrict blood flow, especially to your feet or ankles. Instead, wear all elastic support hose that are made for pregnancy. These can reduce swelling in your feet and will allow for your growing abdomen. You can also find pregnancy support knee highs and thigh highs that apply pressure all along the legs. These can encourage the flow of blood to your heart and prevent swelling. 4. Wear comfortable shoes. By the end of your pregnancy, the ligaments in your body are loosening to prepare for delivery. This may make your regular shoes feel too small, since your feet may actually get larger. Choose shoes that don't pinch and give your feet some room to grow. Consider wearing shoes made of breathable material, like cloth or leather, that can stretch. Your shoes shouldn't have more than a 1-inch heel. Any higher and you could be more prone to falls. High heels also put more pressure on your feet, which can make swelling worse. 5. Stay hydrated. It's important for pregnant women to drink more water than they did when they were not pregnant. Aim to drink 12 to 13 8-ounce glasses of water a day. Water helps flush out your tissues to prevent swelling. Drinking plenty of water can also prevent constipation, hemorrhoids, urinary tract infections, and fatigue. If you're tired of drinking water, remember that milk and juices can count towards your daily fluid intake. Just avoid caffeine and limit your soda intake. 6. Reduce your salt intake. Your doctor may have already talked to you about watching your salt intake, but you may want to cut back a bit more if you notice swelling. Eat foods that are already low in salt, sodium, and avoid adding salt to your meals. Sodium can cause you to retain fluids, making swelling worse. Instead of flavoring with salt, try seasoning your meals with fresh herbs. 7. Soak your feet. On hotter days, when your feet are more likely to swell, try cooling your feet and ankles by soaking them in cool water. Run a cool foot bath and add 1-2 cups of Epsom salts. You may even want to add a few drops of lavender essential oil to help you relax. You could also drape cold washcloths over your ankles to prevent swelling. Try to stay cool in hot weather, since the heat will make you swell more. If you can, go for a quick swim or soak in a tub full of cool water. Method 2: Recognizing health risks of swelling. 1. Learn what causes normal swelling. Because of the hormonal changes and physical pressure of pregnancy, your feet will probably swell at some point. Hormones can cause your body to retain fluid. This fluid and the growing baby can put pressure on the veins in your pelvis and legs, restricting the blood flow to your feet. You may notice swelling get worse in the evening, in warmer weather, or in the third trimester. 2. Watch for signs of preeclampsia. If you have preeclampsia, your blood pressure increases and too much protein is excreted in your urine. You might see swelling on your face, hands, and feet. You may also have headaches, shortness of breath, or abdominal pain. Since preeclampsia can become very serious very quickly, you should contact your doctor. If you're diagnosed with preeclampsia, your doctor will consider the specifics of your pregnancy to manage the condition. Once you're 37 weeks, the doctor will probably want to deliver the baby to prevent complications. 3. Recognize symptoms of deep vein thrombosis, DVT. DVT is a serious condition during pregnancy because blood clots can form in the veins of your legs. If you notice swelling, pain, tenderness, warmth, or redness in only one of your legs, contact your doctor immediately. DVT can happen during pregnancy because more clotting factors are produced and there's more pressure on the veins of your pelvis. Your doctor will probably recommend starting injections of a medication that prevents the clot from getting bigger so your body can break it down. You'll need injections throughout your pregnancy and up to 6 weeks postpartum. 4. Look for signs of cellulitis. If your swelling is associated with redness or severe tenderness in your feet, you may have cellulitis. Cellulitis is a bacterial infection deep within your skin. You may also have a fever. Pregnancy can increase your risk for cellulitis, so if you think you may have it, contact your doctor. Treatment for cellulitis usually includes antibiotics. Your doctor will choose antibiotics that are safe for you to use, depending on which trimester you're in. 5. Get medical attention for swelling. Always let your physician know about any swelling that you have during pregnancy. You should be checked for more serious conditions. If you see swelling in only one leg in addition to one or more of the following, you should call your doctor immediately. Pain. Changes in swelling. Red streaks on your legs. Swelling that doesn't improve overnight. Swelling on your hands or face.